Good evening, everyone, and thank you for joining us today. I am delighted to welcome you on behalf of Pench PCN. My name is Shabana Kausar. I'm the Digital and Transformation Lead for Pench PCN. We are joined today by Mario, our advanced practitioner podiatrist, and our expert speaker for today. Tonight's webinar is all about podiatry, understanding how to take care of your feet and ankles, manage pain, and improve mobility. Before we begin, please note that this session is being recorded. So if you miss anything or would like to watch it again, we will be sharing the link with you after the session. We hope you find the session informative and practical. Without further ado, I'll hand over to Mario to get us started. Thank you, Mario. Over to you.
Fantastic. Hi, everyone. My name is Mario, and I am a podiatrist based in Pench PCN. So you probably registered patients within Pench PCN. So we cover quite a few GP practices, including Oakfield, Robin Hood, Park Practice, Sandridge medical practice, as well as Highlands medical practice. So I'm just going to start straight away, and I'm just going to introduce into some things that we would actually see within a podiatry clinic. So first of all, we will talk about some common foot conditions. We will talk also about some sports injuries. We will literally touch some base on diabetic foot care, and we will go some skin and nail disorders. So common foot conditions. One thing that we actually see a lot in our clinics is actually plantar fasciitis. Plantar fasciitis is basically a painful heel. So a painful heel is it's basically because of the fact that you're getting a lot of inflammation on the plantar fascia. And if you actually see the actual image that we have on the top right corner, you can see exactly where you would normally get that plantar pain. In terms of the things that we will do for this condition is first of all we will actually assess you. So we will check in terms of the ability of you to walk on it. We will ask you a few questions in terms of when it happens. In these circumstances, plantar fasciitis is a lot more common first thing in the morning when you step the foot onto the ground, just as you come off the bed. So in terms of treatment options, we would advise you to rest, to put some ice on it just to reduce the inflammation, as well as we will give you a set of exercises just to try and get some form of rehabilitation on that fascia. If in case we suspect that the plantar fasciitis happen to occur because of the fact that you have some form of deformity on the foot, or your foot rolls in quite excessively, or you might actually recommend some kind of insoles, or what we call orthotics, as well as prescribe some medications. Injections are indicated at times, although we wouldn't advise it generally. But if it's a severe case, then we might be able to provide some form of injections within the practice, as well as in extreme cases, which are extremely unusual, we might refer you to the orthopedic team down at King's. So yeah, I'm just going to move on to the next one. Something that can be quite confusing. We might be getting also heel spurs. So that's slightly different from the actual plantar fasciitis. As you can see on the top left corner, the bottom corner, you can see that the plantar fascia is a little bit further to the front, further to the right, whilst the heel spur is a little bit more, it's more attached to the bone. So in the case of a heel spur, this really is really associated with an injury, specifically individuals that have been walking quite a bit on their heels, or individuals that started walking a lot more than normal. They will usually develop this condition, And it's usually relates to the fact that the attachment where the bone and the tendon, or the fascia, I should say, are attached, can create a small calcification point. So that calcification means it will create a new extra bit of bone that can actually predispose you to a lot of pain. So we will see that, as I said, with patients that actually are fairly active, or individuals that start to put on quite a bit of weight, and they're actually in their path of actually losing that weight. How do we actually treat that? We will provide some form of stretching exercises to relieve some of that pain, as well as we will probably refer you to the community team at Beacon and Beacon for some custom orthotics. We will advise you in terms of getting some form of medication just to alleviate that pain from that area, and as well as advise you in terms of what footwear you should be wearing to maintain further pressure from that area. Another common condition that we would see is bunions. Bunions are extremely common. It's basically some form of deformity on your big toe, and as you can see on the photo here, it's just basically the bone itself changes in shape and starts to deflect and putting more pressure across the other toes of your foot. That itself could be painful, but at the same time, it doesn't necessarily has to be painful. So what we will usually do on that case, we will assess you once again. We will find whether actually the type of the foot that you actually have, which could be a flat foot, might be a lot more predisposed for things like bunion. Sometimes there is a bit of family history of a bunion, just because the ligaments, the tendons, and the different structures that obviously are within the bone complex can predispose you in getting these bunions. I usually say to my patients, if bunions are not painful, then do not proceed with any type of. I would not personally proceed in terms to refer you for orthopedic assessment. If they are painful, if they are affecting your quality of life in any way, please do see us, and we're a lot more likely to give you advice using conservative methods to try and alleviate some of the pain. And if that pain does not go away, then we're more than happy to refer you for an orthopedic assessment. Now, in terms of orthopedic assessment, you can see some images in there. So you can see some what we call a minimal invasive procedure, and what they do is they cut off a bit of that bone, and so they resect part of the bone, and then they put a nice little pin across just to try and straighten that toe. Success rates vary between a person to another person. So I would probably say it's a little bit more successful for individuals that are not fairly active. If people are extremely active, then the likelihood of that actually reoccurring is quite common. So hence why, as I said, I wouldn't refer unless it's actually quite painful and people have tried every possible conservative treatment and it hasn't worked for them. So the next things we'll be talking about is sports injuries. One common thing that we would see is it's Achilles tendinitis. As you can see, the Achilles, you can see I'm so sorry about this photo, it's not that clear, but we can see a massive kind of a lump on the back of your heel. It is an overuse injury. Usually we would see it with young individuals that have taken on the gym, or they might have been taking a little bit more exercise. And what happens is the tendon that provides your gastromuscles, what we call the Achilles tendon, becomes inflamed. It can get quite painful, and it can become quite inflamed as well. And what we would normally see with these individuals, it will be pain, stiffness across that region there, significant amounts of swelling, tenderness, and it can be worst thing in the morning, as well as after having prolonged periods of activity in the gym, or if you've gone for a brisk walking. So in terms of rehabilitation and treatments, we would more or less advise the same things: resting it, taking some time off, applying some ice just to reduce the inflammation, stretching the muscles just a little bit, just to try and get that blood into the area to allow better healing process. As well as we would recommend some specific footwear just to deflect the pressure away from that tendon, which obviously is in a lot of pain. Next condition, it's ankle sprains. Now, I've got two photos in there. They're not the same thing. So the photo on the top, that's a typical ankle sprain. And as you can see, there's a lot of swelling, there's a lot of bruising in the area, and also the swelling is a little bit lower down. The one at the bottom, it's an ankle strain. So what do we mean by ankle strain? It means that if we have an ankle strain, we're a lot more likely to affect different structures, including the muscle and the tendon, whilst an ankle sprain usually relates to all the different ligaments that maintain the integrity and the structure of your ankle joint. So usually, I mean, how would you differentiate between them two at the beginning of the actual injury? Well, if you get an ankle strain, you're a lot less likely to be able to walk on it. Whilst an ankle sprain, you might not notice anything at all at the time. You might feel that actually something's going on with my foot, but you will actually find those symptoms actually kicking in after 24 hours, where things will get quite painful and you get quite significant amount of bruising. Before we actually advised about ice, which is ice compression and elevation, this stage we are actually having the police approach, which is protection, optimum loading, ice compression, elevation. Now, this new terms, protection and optimum loading, is the fact that, okay, we might be taking some time off in terms of putting some pressure on those on these heels, but it's important to make sure that we are going back into rehabilitation stage as quickly as possibly we can. Why is this? Because evidence and research suggests that you're a lot more likely to get faster rehabilitation and faster healing process if you are putting a little bit more weight on it, and if we are able to do a little bit more of exercises on it, including stretching it, flexing it, and extending it. Next injury that we would see is stress fractures. We can't really see that at the beginning, but more or less fractures across the toes are quite common. We can see different areas, obviously, of the fractures can be affected. So you can see the metatarsal fracture there on the big toe. You can see another fracture on the second toe. We call that, so this is a mud fracture. This is what we call a Freiberg's fracture. And then we have a lot more fractures across the small toe. Anyone who's familiar with sports or he's into sports, we have fractures called avulsion fracture and Jones fracture. And a quite well-known player that obviously suffered with avulsion fractures was actually Wayne Rooney. In the case that we suspect a fracture, we would actually send you for an X-ray. Sometimes X-ray might not be indicative of the actual fracture because it might take up to 6 weeks for that fracture to actually show onto the X-ray. So if we see evidence of the fracture, we will still advise you to actually take a bit of rest to allow that area of the fracture to heal up. Now, the specific fracture on the fifth toe is a little bit harder to heal, just because the blood vessels, the small capillaries that supply the circulation on that area, they're a little bit harder to find. So therefore, we would expect this type of fracture to last for quite a bit of time. I know you're probably thinking how long. I can't tell you for a fact because every person is different. And if you have other comorbidities such as diabetes, peripheral vascular disease, which is basically lack of circulation, this will have this will take considerably longer time for those fractures to actually heal. But I would probably say to you, if obviously you suspect that you have a fracture, please do attend your podiatrist or see your GP, and we're a lot more likely to get something done just to make sure that obviously this eventually heal up. So now we're going to touch base in terms of diabetic foot care. So I understand that we have quite a few diabetic patients. So the first thing that we're going to talk about diabetic foot care is signs and symptoms of diabetes. So one of the things that we would see with a lot of the patients that have problems with diabetes is they would start complaining about certain things like pins and needles, burning sensation on their feet, tingling sensation, cold feet, as well as very, very hot feet. And it feels like, and also people will complain about electric shock. Now, diabetic neuropathy relates to the fact that if your levels of sugar are extremely high, what can happen, or if they've been high for a prolonged period of time, so you have no good control of your sugar levels, what can happen is it means that the actual nerves are affected from these sugars, and there's a process called glycosylation, and that process means that the nerves are being attacked by the sugar, and it will create this situation where you are either feel things a bit more than normal. So you have what we call hyperesthesia, which is the burning and the electric shock kind of symptoms, as well as the fact that you get the pins and needles sensation, which obviously is not a normal thing to feel. But sometimes, if obviously neuropathy develops furthermore, then we would see that these individuals that have diabetes might not feel things completely. So you might be walking on a nail, and literally you won't even feel that nail actually that might have stuck into your foot. So it's important that if you have diabetes, you have your yearly checks with your nurse, and if your nurse suspects that you suffer with neuropathy, she would refer you to either us, or she would refer you to the community team that are dealing with this kind of situations with neuropathic feet. Now, why is important neuropathy for us? It's because of the fact that if you're neuropathic, you're a lot more likely to develop things like foot ulcers. So as you can see, we have different foot ulcers there. So this is a typical neuropathic foot. And if neuropathic foot obviously has other comorbidities such as arterial problems with the circulation, then you're a lot more likely to get things like gangrene. I don't have to, I mean, no matter how much I stress this one out, the importance of actually checking your feet if you're diabetic, it simply won't be enough. Because if you develop a situation where you're actually neuropathic, you have no sensation under your foot, and you develop problems with the circulation, then the likelihood of that foot becoming amputated in the near future is actually extremely high. So yes, it's important to make sure that you get those levels under control. If you are getting painful neuropathy, if you're getting this sensation of feeling lots of pain under the foot and that affects the way you walk, then please see us, and we're a lot more likely to start you off on some form of treatment to stop you having these pains and stop you to expose you to more pressures under the feet, which can predispose you to more hard skin, which in return can cause breakdowns, ulcers, infections, and in result can cause the gangrene. The infection can in return cause also gangrene, as well as the lack of circulation. So this is why I say importance of early detection. If you are getting the hard skin, as you can see in the picture there, then you're a lot more likely to get a blister, or a blood blister in essence, which can in return can cause an ulcer. And that's also, if it gets infected, can obviously affect the bone, and if it affects the bone, then we'll have to refer you to to the emergency department for some intravenous antibiotics, and at times that infection is actually within your system, and it doesn't affect just the foot itself, it affects you as all your body. Then it probably suggests that you might have to stay in the hospital and you have to be admitted. The next thing that I'm going to be talking about is skin and nail disorders. So one common thing, and I'm sure probably the majority of you will be complaining about, it's athlete's foot. So athlete's foot is a fungal infection. It's a fungal infection of the skin. And I've got just different presentations. So a common thing that we would see is this photo on the left-hand side. And we can see obviously that the actual webbing of the toe becoming very, very wet and becoming very, very itchy as well. And then you try to wash it and you try to use all kind of creams to try and get it better, and it doesn't get better. Under these circumstances, and this is a mistake that lots of doctors do, unfortunately, as well. If you have a wet athlete's foot, we do not recommend creams to use in between your toes. That's because if you have something which is already wet and you try to put something it's more wet, it's just going to stay wet and it won't dry out. We want to dry off this area there. So therefore, we would recommend something like a drying powder. So something like Dactarin powder spray would be one way of dealing with this. Another thing we will actually advise you is to just make sure you dry really well in between your toes. If you can't reach, obviously that's a problem, but for the ones that they can reach, I do recommend the patients to use something like a cotton bud, an ear bud, for example, just to dry very well in between the toes. And that should actually improve the symptoms eventually. If we obviously have a situation just on that picture, as we can see in the middle, we would actually use a cream, but we won't use the cream indirectly in between the toe, as we said, because it's a lot more likely for that to get wet, and then we are just spreading the infection from the top end of the actual toe to the middle of the toe, and that itself can create even more problems. But in a situation where we've tried creams, topical ointments, we tried the creams and we tried the powder sprays as well, and it hasn't worked, we could recommend you something like an oral tablet, which is terbinafine tablet, which you can get on prescription from your doctor or from your podiatrist. The only problem with that, because of the toxicity, we would request you to actually have a blood test after 6 weeks just to make sure it hasn't affected your actual liver in any way. Just to give you an image, a microscope image of how it actually looks, you can see that looks it's like a spore. So fungus is everywhere. And if you're going to catch it, you will catch it no matter what you do. So if you come across it, across the fungal infection, please do come and see us, and we are more likely to give you a specific advice depending on how it actually looks. Another problem is fungal toenails. So I've got, again, different images there, simply because fungal toenails, you have different species, you have different specific funguses that can actually cause different presentations. So as you can see, a typical case of a fungal nail is this one. This is what we would expect to see. Now, in the case when we see this, we would expect there's going to be change of color. So it's going to be very, very yellowish. And you can see there's different types of like vesicles that we can see within the nail. Now, we expect this to be not just the actual nail itself, we expect that to be actually under the nail, or what we call the nail bed. In this case, if you do have fungal infections, then again, we will advise you some form of treatments. So we will advise you to use antifungal nail lacquers. But those lacquers, to be effective, we will advise you to actually file the nail as much as possible. Try to expose the fungus onto the surface as much as possible, because if you try just to apply the actual antifungal treatment on this nail, the likelihood of that being effective is actually very little. And understand that lots of you probably have spent probably tens of pounds on these antifungal treatments, and which have not worked, and you probably are despair in terms of what else you could do for this. But I always say, I think the most important advice, filing it down. Don't use the files that the actual treatments contain. I would probably get a proper file, a really good rasp, and I can actually just try to file that nail as much as possible to try and expose it to the surface. Now, this picture, it's a slightly unusual one. As you can see, this fungus is actually quite, it's white. Now, this is a different type of fungus. So this is what we call candidiasis of the actual nail. Just because of the fact that candidiasis doesn't just occur on the nail, it occurs within the genital region as well. In these circumstances, we will actually recommend patients to use Canesten cream. So for the women, they're probably quite aware of. Nope, they would actually request the Canesten. I would probably say to my guys as well, don't be afraid to go to your pharmacist, say that I suspect I might have a fungal infection. It is quite whitish, so I probably might require some form of antifungal treatment, and do request Canesten Duo. It does work quite well on that. But again, the same advice as this one, try to file it as much as possible to try and expose that nail to the surface and the fungus to the surface, so that way the treatment will be a lot more effective. Another problem that we have, as obviously everybody seems to be having, is corn and calluses. Now, corns are more or less, it's a combination of a hard skin or callus with friction and pressure. And as you can see, you can get them in different areas. You don't have to get them necessarily under the foot. You can get them in between your toes, and you can also get them on the bottom of your toes, and at times you can also get them on the back of the heel as well. So yeah, if you do get those corns, which can be extremely painful, you can come and see us. We can make some recommendations. I mean, in terms of my own preference as a clinician, I have found that if you use a low percentage of salicylic acid, then it's a lot more likely to be beneficial. So I know that some of the patients have been using this carnation corn plasters, which is fine if you don't have any comorbidities. When I talk about comorbidities, I mean things like problems with the circulation and diabetes, things like rheumatoid arthritis, things like sickle cell anemia, stuff that can actually predispose you to more complications. So as long as you're a healthy individual and you haven't got any problems such as the ones that we just mentioned, I have no problem you using these corn plasters whatsoever. Sometimes if you get calluses, we would recommend things like anything with urea. So if you want to write it down, urea, it's basically U-R-E-A, so urea. And we will, any cream with urea in it should be effective to try and get rid of that callus. Also, things like salicylic acid, again, it works quite well. But if obviously the hard skin is quite built up, we would recommend you to actually find a local podiatrist and see if you can actually get some form of treatment in terms of actually reducing it down. I'm not sure if I have more things to mention. I think that is it. So it was a very, very generic presentation. If in case you want us to go in more details for some specific things, including diabetic foot care or more skin deformities and skin problems in general, please do let us know. Provide us some feedback, because obviously we can make these sessions a lot more specialized.
A big thank you to you, Mario, and thank you for everyone. Thank you to everyone for joining. Thank you. I'll try and share the link in the chat So you will have or I'll share it in terms of maybe a message. So thank you. Thank you, everyone. Have a good evening. Bye.
Have a good evening, everyone, and do hydrate during these days, please, and stay safe.
Bye.
Bye-bye.